Caritas, and I'm really appreciating all the great work that these hospitals do. We are looking forward to further engaging in this public process before the Attorney General and Department of Public Health to really dig deep into this proposal to analyze whether it indeed satisfies the Attorney General's standards of serving the public interest and the needs of the host communities. Mr. Nozel, I have to say we're still troubled by the fact that the application is still incomplete. There's a number of documents that are still not available for the public to look at. And we're now 3 weeks into the public hearing, and the public does not have access to all of the documents pertaining to this process. In fact, there's a number of folks who are planning to come and testify tonight who are not coming because they don't have all the documents. And we would ask that we can consider some other forum for them to speak. This process has added importance as the stakes around this conversion have grown over the past few weeks. As many of you may have read in the Boston Globe, Cerberus appears to be interested in another batch of hospital acquisitions here in neighboring Rhode Island and the Merrimack Valley. The decision for these 6 Caritas hospitals will certainly have an impact on further considerations. Healthcare for All believes that community hospitals are indeed an integral part of the fabric and well-being of the community, just like St. Anne's is. When well run, these hospitals provide vibrant and robust outreach, care, and support for the communities they serve. We do recognize the issues currently facing Caritas and its operation. We understand the pension fund is broke, and we know the physical plants are in need of upgrade and repair. We know that Caritas has been looking for an infusion of capital for over 5 years, and you have heard, and you'll hear after me, I'm sure, the statements of many dedicated staff from St. Anne's showing their enthusiastic support for this proposal because it will fund this pension system and improve the facilities in which they work. So for me, it's been great to hear about the past and the great services that St. Anne's and the other hospitals have provided. And it's great to hear about the present and how Cerberus has appeared to come in to the rescue. But now, Healthcare for All thinks it's time to talk about the future. What matters most is what this hospital is going to look like next year, what it's going to look like 3 years down the road, and what it will look like 5 years and beyond when the community will need the continued services that this vital community hospital provides. So Healthcare for All is here today and is focused on this conversion process, not because we want to make sure the proposal on the table before us, because we want to make sure the proposal on the table before us is the right deal to make. Not only for jobs and pensions, not only for construction projects, not only for local and state tax base, but for the health care that this community needs in the future. Because things are going to change here. Cerberus has put an offer on the table which will bottom line change the ownership of St. Anne's and the Caritas network from the Archdiocese of Boston to the New York-based private equity firm Cerberus, a venture capital firm which has never owned nor operated a hospital. Wall Street will soon be in charge. 4 Cerberus staff based in New York, and most likely Yankee fans, will soon be in charge. The most significant change will be in the conversion of the hospital from a nonprofit to a for-profit hospital. So what does that change? The first thing it does is that the hospital will now have to pay taxes, which is good for the local and state governments. The second is the hospital will now have to deliver profits for its investors. So what is going to change? Well, over the past couple of years, Caritas has been able to shift from a money-losing operation to a company that's now in the black. If the deal goes through, they'll have a few more lines on their expense sheet that were not there before. The first one is taxes, local, state, and national, which we heard earlier will estimate it at $20 million a year of new expenses. Returns for their institutional investors. Cerberus's fiduciary responsibility is to create a return on their investment for all their sponsors. Third is payments to Cerberus staff. We now have a new layer of bureaucracy in place in this operation that needs to be funded. And continued funding of the pension fund. Where is the money going to come from to fund these new expenses? Cerberus will either need to increase their revenues dramatically or decrease their expenses to meet these new demands. What is going to change so that they can do that? Will they cut expenses? To cut expenses, is Cerberus going to reduce staff? When Cerberus bought Albertsons and Mervyn's supermarkets changed, within a month they laid off 1,000 workers. Now we certainly appreciate and are in full support of the contract agreements that are in place that will protect SEIU workers for the near future. Is Cerberus going to close down underperforming hospitals? When Cerberus bought Albertsons and Mervyn's supermarket chain, they closed down underperforming stores. Is Cerberus going to eliminate costly programs that do not provide significant revenue, such as mental health and substance abuse care? And to raise revenue, is Cerberus going to increase the overall volume of patient and procedures done at the hospital, providing new burdens on the current staff? All we have now is conjecture as to what the future will bring and what changes Wall Street will drive at St. Anne's and the rest of the Caritas network. In an article from the Washington Post, Cornell Law professor Charles Whitehead, a financial analyst, states, in more than a decade of buying into down and out companies across 3 continents, Cerberus Capital Management has applied a similar strategy to most of its targets. Cut, 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 and cut some more. We just want to know what the plan is, because each of these options and any others will have an impact on the accessibility, affordability, and quality of care that St. Anne's is able to provide. We have 2 more major concerns. One is, does the price tag which the proponent has offered adequately represent the true value of this network? Our research has shown that the first offer for hospitals is often low. Example of this is the buyout of a hospital in California by Wellspring. The initial offer was $100 million. After analysis from the Attorney General, the price that was agreed on was $3 billion. The initial offer was lowballed by over 30 times. We urge the Attorney General to use its power to hire an independent analyst at Cerberus's expense to evaluate these assets and liabilities of the network. And second, why has Cerberus failed to propose the formation of an independent foundation based in Fall River and the other 5 host communities to provide the community resources to address local health concerns? Such a foundation is usually a staple in other similar hospital conversions, including the 2 here in Massachusetts with St. Vincent's and Metro West. In closing, after the first 3 hearings, we are concerned that this process is being viewed as a thumbs up or thumbs down manner, a take it or leave it process. History shows that this is not the case. While some conversion applications have not been approved or been withdrawn, many have and have been approved with conditions that improve upon the original proposal that's on the table. The North Shore Medical Center conversion in 1997 and the Metro West Medical Center conversion in 2004 are 2 prominent examples of that. We have heard from Dr. De La Torre tonight and others who have spoken with clear passion and dedication about the benefits of this proposal. That is not to say that this proposal does not have room for improvement to ensure the accessibility, affordability, and quality of care for residents in Fall River and beyond. With the health of so many residents at stake, Healthcare for All wants to make sure that the potential new owners will have the capacity and the will now and in the future to continue to provide accessible, affordable, and high-quality care to the residents of Fall River and beyond. Thank you.